Thanks for joining us again, everyone. Hopefully you enjoyed our last video of understanding Alzheimer's. Today, Dr. Aaron and I are going to dig a little bit deeper into the types of Alzheimer's. So I know that we've briefly discussed them in other videos, but could you just remind us again, what are the 6 types of Alzheimer's?
Yeah, and I think to save time for the viewers, the benefit of this video is going to be you can watch this video and get a good idea of which type you might be either trying to prevent, or maybe you have a family member, you're not sure what they have, or you're trying to just slow down a process. This will save you some time, because then you can know what video should you watch after this video of the different types. So there's really 6 different types of Alzheimer's. The first one is inflammation. The second one, Dr. Bredesen, he calls it 1.5. It doesn't really matter what you call it, because no one's really put like diagnosis codes to these 6 different types.
Okay.
But type 2, or type 1.5, as Dr. Bredesen calls it, is people dealing with insulin resistance in the brain. Type 3 is looking at people that are dealing with trophic, is what Dr. Bredesen calls it, or they don't have the nutrients or the hormones that the brain needs to work the way it's supposed to.
Okay.
And then the 4th one would be people dealing with toxins. The 5th one is people dealing with a vascular issue. They don't have enough blood flow going to that part of the brain. And then the last one would be traumas. And again, a person doesn't need to get caught up into, like, is that type 1, type 2, type 3, because they really aren't typed that way, but there's 6 different types.
Okay.
So.
And why is it important to even know that there's these 6 different types then?
Yeah, absolutely, because the big reason to know why is if you know what type you have, then you got a good idea of what's driving it, what's the underlying cause, so that when you look to again, either prevent it, reverse it, slow it down, you'll know what factors to look at, what underlying causes that need to be addressed in your life. Yeah.
Okay. So like you said, the big benefit of this video is to help people determine, where they can dig a little deeper. So could you share with us a couple of basically red flags or things that you might look for with each different type?
Yeah, absolutely. So the first one I'd mentioned was inflammation, and this one, it can be kind of difficult to pinpoint what some of the underlying causes are, but there's definitely some certain things to watch for. If you ever have inflammation, like you ever injured, sprained an ankle, you know what that inflammation feels like, because it's painful, it swells up, but that's not what we tend to experience in the brain, because the brain doesn't have pain receptors, so you wouldn't have pain. But what people will start to see is they may have like early indications of like brain fog, or maybe they need to take naps in the afternoon because they're just getting like that fatigue in the brain. So those are signs that, early signs that they might have it. But then I would also say looking at lifestyle issues, like eating a lot of processed foods, or if a person has a history of like a gluten sensitivity, or maybe they've been diagnosed with celiac. I would also say digestive health actually will be a pretty good indicator of how your brain health is, because they're so tied together. And so when we look at trying to figure it out with someone that has inflammation, we will look at blood labs will also tell us a lot, because there's some inflammatory markers that we can look at. But the ages of those people are typically upper 70s, 80s and 90s and above. That's a pretty good indicator as far as age goes. Gender, it's going to impact women more than men. Some people would say that's just because women are living longer, and there is definitely some truth to that. So, but you will see it more in women than you will see it in men. And then, as far as the symptoms, typically what you notice is that their memory is the first thing to go. And so that's what you'd see with a person dealing with inflammation. Person dealing with, did you have a question?
I was just going to reiterate, so with inflammation, it would really be red flags, obviously losing some memory, but someone who has a history of digestive issues, brain fog, tiredness in the afternoon.
Yeah, absolutely. Yeah. And then, like I said, we can all a lot of times we'll do blood tests to help us determine whether that is the case or not, looking at those inflammatory markers. Then the next one, when we look at insulin resistance, again, insulin is what shuttles sugar into our cells. And if we can't get that fuel into our brain cells, then our brain cells can't work the way they're supposed to. Some people would call it type 3 diabetes. And so a few things to watch for those people is you're going to see a history of blood sugar issues. So typically what you see is not too much sugar. It was usually those people started with like a hypoglycemic type of an issue. So if you remember the Snickers commercials where you're not yourself when you're hungry, or you hear people talk about, oh, I'm hangry right now, I'm hungry, so that makes me angry. That's a sign that your blood sugar is dropped and you have poor blood sugar control, and that's usually a precursor to people developing insulin resistance. And so people that have insulin resistance of the brain, they're going to have, again, they'll probably feel tired in the afternoon, or really actually anytime they eat food, they might feel tired right after they eat that food. And then some of the other things to look for, again, is age plays a part in it. So they're usually in their 80s or upper 70s. Same with inflammation. I didn't mention this. You usually will see some family members that dealt with it, and then memory is a big sign, like early sign of having that. So you can see how these can be a little harder to figure out, right? And they can go hand in hand, meaning that you can have both of those. You can have insulin resistance and inflammation, and so a little harder to determine those. But blood tests really play a part in helping to know the difference between those two.
Okay, good. And so what would the next one be?
Yeah, so type 3 is going to be trophic, or again, not having either the nutrients or having the hormones to help the brain work the way it's supposed to. So again, you'll see this in people in the upper 70s, 80s, and 90s and above. So again, you really harder to determine because the age
same age group.
Same age group. You will see definitely this one more in women because as women lose their ability to make estrogen is very protective, especially for the part of the brain, the hippocampus, which is where our memories are created. And so you will see it more in women. You will again see it more with a memory issue first. And so again, when you look at these three, how do I know the difference? Again, blood tests make a big difference. But I'd also say, again, looking back at a history, so if you're a woman and you had a history of menopause did not go well for you, your cycle and you were menstruating was really off, having a history of like PCOS, having a history of
endometriosis maybe?
Yep, endometriosis, having really bad premenopausal symptoms. All those things can definitely set someone up for later on in life that those hormones were off then. As you get older, they don't get better typically. So those are the things to watch for with someone that's dealing with a trophic. Another one I mentioned, nutrients. So a B12 deficiency or anemia, so iron deficiency, that can decrease the blood flow to the brain. B12 is very much needed for nerve cells to work the way they're supposed to, so that could also be a reason. So again, blood tests can really help to determine that, but you can also look at a history of how was my health prior to as I got older.
Right, really important and interesting. So mainly women, lots of indications during kind of pre-menopause, menopause that they would be at risk.
Yeah, for sure.
Okay, great.
Yep.
So tell us a little bit more about type 4.
Yeah, so when we look at type 4, that's toxins. And this one's going to actually really stand out a lot different than the rest because you're not going to see a familial type of, you may not have anyone else in the family that's dealing with Alzheimer's, and all of a sudden this one person in the family does. It's usually going to be earlier onset, and so you might see it in the 50s, 60s. I remember there was a lady at, my wife's grandpa had Alzheimer's, and there was a lady there that was 50 years old that was already dealing with Alzheimer's.
Okay.
Yeah. And so you're going to see it earlier on. The other thing that you're going to see is they're usually more aggressive. So it's actually not their memory that gets impacted first. It's usually more the frontal lobe, so their behavior gets impacted. And so those are the things that you'd watch for. It'd be nice to know that exposure to toxins, and that is for sure someone had a job that had to work with toxins all the time. but we live in such an age and that most people are getting
Right,
exposed to.
everyone's dealing
Yeah,
with
so
it.
it's really hard to say, hey, it's because you got exposed to toxins. That's probably
Right.
why you have it. So you got to look at those other things as well. There are blood tests that we can do that looks for toxins as well, like looking for mercury and such in the blood. So there is ways to do it through blood testing, but probably the best is looking at the age of it and their behavior.
Yeah, it sounds like that one is much more distinctive than several of the other ones, just because it presents so differently, earlier age and more aggressive behavior.
Yeah,
So.
yeah, absolutely. So the last two are probably some of the easier ones to actually look at, the trauma and vascular. Trauma, most people can remember that they had like multiple head traumas.
Right.
And so that can...
Hopefully.
Yes, yeah, so they may not remember actually having the trauma, but someone told them about it.
Yeah.
Now the problem with that can be that years ago, playing sports and stuff, a person can get their bell rung and sent back out on the field, and
Right, that was a huge issue.
yeah, and so they might not have thought that they ever had a concussion, but I think looking back at it, most people can look and say, yeah, that probably was a concussion. So a history of traumas is going to be, it's going to have to be present for it to be traumatic cause.
Right.
And then the other thing you'd look at is, again, early onset. And so, again, looking at being at where my wife's grandpa was, again, a younger person, but a history of being a gymnast really did, to me, point to that probably was a traumatic reason why that person in their 60s already dealing with Alzheimer's disease. But typically it's going to be earlier in age. And you would actually see it more in men, not because men are more susceptible because of being a guy, but they're more susceptible because of the sports that they play.
Right, being in the high impact.
Yeah, they're more likely to have head traumas than women.
Right.
So you'll see that. But again, it's usually not a surprise that if it was due to traumas, because they know that they have the traumas. And then the vascular, usually they have other signs of vascular, or you got the onset was from a stroke. And so if you had a stroke, you're more than likely had that diagnosed. Or if you have cardiovascular disease, you know that, okay, I'm at risk for not getting enough blood flow to the parts of my brain. So, so that's not usually a surprise either. And again, looking at the difference between men and women when it comes to vascular, men and women both have high amounts of heart disease as issues as we age. So you do see it more in men, but not real significant. Because women do get impacted by cardiovascular disease as well. So again, those two are really, it's usually much easier to diagnose.
Right.
And unfortunately, those two are harder to work with, though, too, to help somebody. If you've had a stroke and you've got permanent damage to those cells, that's not easy to come back from. It can be, a person still could be, but it's definitely those two are going to be harder to deal with.
Right. So would you say those two are harder to deal with in terms of reversing or even kind of maintaining or preventing?
Yeah, I'm glad you asked that question, because I would say it's more for reversal.
Right.
Preventing, actually, traumas, you can obviously do things to prevent traumas, avoid sports that would cause that, or make sure that if you're in that sport, you're doing the right things so that you're less likely to develop get hit traumas.
Right.
And then when it comes to cardiovascular, there's definitely a lot of things that we can do to help with good cardiovascular health. So.
Yeah, so those, it sounds like those two especially would be really important to watch preventatively. Like even if you have a child or grandchild in sports like football or, another high impact sport, that might be a really interesting video for them. I guess the video itself wouldn't necessarily say what to do to prevent.
Yeah, so when we get to the video on trauma, we will talk about that, because that is very controversial. You'll see some neurologists saying, oh no, it's as long as you're wearing the right protective gear and strengthening the neck and such, then you're less likely to, or you can definitely get traumas from riding a bicycle. So there's a lot of places we can get that. So we'll definitely address that, because that will be somewhat controversial. But I do think that you do want to minimize your risk.
Right.
And so there's definitely ways to do that.
And then I think there's just one last question that I have. We touched on a little bit of the demographics of each one, but I was curious for the cardiovascular or the vascular type. is there a certain age that presents itself?
Yeah, so it's going to be similar to the first three, that
Okay.
it is going to be that upper 70s, 80s, 90s. But we are seeing cardiovascular disease impacting people even younger now, so we're going to start to see even people in their 60s, early 70s developing it because of the poor cardiovascular health that so many people have. So it does fall within that same range, but again, if you want to differentiate it between those first three, then you look at blood markers can be helpful, and then just looking at cardiovascular health in general.
Okay, awesome. Well, thank you so much for sharing a little bit more about each type. Hopefully it's been really helpful for everyone to be able to learn a little bit more, and so you can decide if you want to watch all 6 of the videos that dig really deep into each type of Alzheimer's, or if there's a couple that you want to check out. So stay tuned for those videos.